Hello everyone. I'm so glad that I can record this video. We record this video for our lesson, medical terminology, because our teacher asked us to do it. Now, I want to talk about a disorder that we choose and we want to talk about it about 5 till 10 minutes. Our subject is diabetes. Diabetes is very famous between the disorders, and lots of people know about it. We can see lots of people in society that they have diabetes. At first, I want to introduce what is diabetes. Diabetes is a chronic metabolic disorder that characterized by elevated levels of blood sugar, as we call it hyperglycemia, resulting from defects of insulin secretion, insulin action, or both of them. Now I want to talk about the core problem. The core problem is that the body cannot effectively use glucose for energy, leading to its accumulation in bloodstream. Glucose is the primary fuel of the cells. Insulin acts as a key, helps the glucose to enter to the cell. Now I want to talk about three kinds of diabetes. Diabetes type 1, autoimmune destruction of pancreatic beta cells, absolute insulin deficiency. Diabetes type 1 happens typically suddenly and most of the times in childhood, but it can happen at any age. At the end, we want to discuss about treatment requirement. In that kind of diabetes, absolutely we need exogenous replacement of insulin. As we see, all of the people has that problem, use insulin, and we can see it in society. Now, type 2, often secondary to peripheral insulin resistance. And if we want to say that when happens, and it is most common in adulthood, associated with obesity as sedentary lifestyle. And treatment requirement, as we want to talk, entirely managed with lifestyle and oral agents, and sometimes needs injectable therapies like insulin, as we mentioned in the last section. At the end, I want to talk about gestational diabetes mellitus. As definition, we have glucose intolerance first recognized during pregnancy. If I want to talk about the risks, increased risk for both mother and baby. And now I want to talk about the role of insulin and glucose metabolism. At first, I want to talk about glucose source from dietary carbohydrate breakdown or hepatic glucogenesis. And if I want to tell the progress, at first, after a meal, blood glucose rises, pancreatic beta cells release insulin, and then insulin binds to receptors on muscles, fat, and liver cells. This binding causes that glucose can enter to the cells. In that section, I want to talk about symptoms and complications. At first, let's review key symptoms of hyperglycemia: polyuria, polydipsia, and polyphagia, blurred vision, and a slow healing source, and frequent infections. In that section, I want to talk about acute complications. Acute complication or metabolic emergencies. The first one, diabetic ketoacidosis (DKA). Second, hyperosmolar hyperglycemic state or HHS. And now I want to mention long-term complications, macrovascular and microvascular. At first, macrovascular. Underlying cause: chronic hyperglycemia accelerate atherosclerosis across large and medium-sized arteries. Coronary artery disease, CAD can increase risk of heart attack. Diabetic patients most of the times have silent MI due to autonomic neuropathy masking the chest pain. Cerebrovascular disease, increased risk of ischemic disease, and peripheral artery disease, PAD, reduces the blood flow in conjunction with neuropathy. Now, at the end, long-term complications, microvascular. Underlying cause: damage to basement membranes of small vessels due to chronic exposure to high levels of glucose and stress. Diabetic retinopathy: damage to retinal capillaries, hemorrhages, and proliferative changes, and it makes bleeding cause of preventable blinding. And at the end, diabetic neuropathy, symmetrical loss of sensation, pain, or tingling, usually starting in the feet. And at the end, thank you very much for your attention.